Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Hello, this is a special edition of the Lunch and Learn with your host, Dr. Barry, and today I have to speak a topic on my mind. Normally we wait for Thursdays to drop these episodes, but it was becoming so compelling that I just felt like I had to drop everything I was doing and put a podcast out there to kind of talk about a topic that's been all over the news and something that I've unfortunately been seeing talked about in an incorrect manner. So I just wanted to kind of put it out there. Today's episode, we're going to be talking about STDs, and we're also going to be talking about Usher Raymond. And as a fan of Usher Raymond, I thought I would never have to talk about STDs and R&B host that I like. But, that's how the cookie crumbles sometimes, and here we are. So very recently, probably in the past couple of months, I've been seeing news reports on various STDs, and a couple of them. We're not going to touch on all of them today because there's a lot, unfortunately, that we can touch on, but we're going to talk about three. We're going to be talking about syphilis, we're going to be talking about gonorrhea, and then we're going to be talking about herpes. Of course, we're talking about herpes because of Usher Raymond and all of his recent news reports of lawsuits regarding that. So I want to first, talk about syphilis, and we'll talk about the quote-unquote rise of syphilis. And as always, what we like to do is kind of give an introduction of what syphilis is, what the diagnosis is, and kind of go from there. So syphilis is a STD. Of course, it's actually divided by different stages, and based on the different stages will depend on what they present and what a person will walk into my office for. And just a side note, and I've actually mentioned this in the past, a very common reason why I can get men to come to my office. One, we talked about in earlier episodes being erectile dysfunction. But the second one we talked about actually being due to getting STD testing. So fortunately, there's a couple of reasons, a couple of ways to get your men to the office is to either, have some issues in the bedroom, and a couple ways to get your men in the office usually kind of involve bedroom activities. One is either to, spruce up the activity because there's some issues going on. And the second is usually because they want to get tested. So that's usually a reason why I can get men to come in my office. But again, back to syphilis. Syphilis, again, is divided by stages, and kind of depending on the stage will depend on the presentation of the disease. And it's actually spread by vaginal, anal, and oral sex, and can actually unfortunately be spread from a pregnant mother to their newborn. And that's where I think syphilis takes a big point of emphasis for us, is because of that fact that you can have that transmission onto the newborn and then cause very detrimental effects. And at this time, there is no active blood test. There is no blood test that will show any active infection, right? So I want to kind of throw that quick caveat out there right now, just so we can kind of get a gaze of, when we talk about syphilis, kind of what we're dealing with. So I'm going to talk about the different stages. The first one is the primary stage of syphilis, right? So this is the initial stage. This is a stage where you'll have a painless sore, and painless is important. When I talk about herpes, you'll see why. Painless sore, either located at the genitals, either located at the anus or the mouth. And it's usually firm, and it's usually round, and it usually lasts for about 3 to 6 weeks, right? So that's usually the first sign that, I got an infection and I need to go get checked. Unfortunately, most people don't get checked at that time. I wish I could say, every time a person had any type of lesion that they would run to the doctor to get treatment, but it does not happen. That's the reason why we have so many different stages of syphilis. Our secondary stage of syphilis kind of presents as a patient with either a skin rash and what we call swollen lymph nodes. So they'll see some of their glands are actually inflamed, usually around the neck, usually around the armpit area, become inflamed as well. And by this time, the secondary stage hits, those painless sores I talked about in the first one are pretty much gone. And our third stage is the latent stage, right? And latent really means nothing happens during the stage, right? And what's the problem with this stage? This is the problem with this stage, the latent stage, is that because nothing happens, you don't get treated. Because you don't get treated, this disease lingers on in your body system for months and sometimes up to years. And I can tell you, I've had patients in a hospital, and when I talk about the tertiary stage, I've had patients in the hospital, 50, 60, 70 years old, coming in with, complaints of altered mental status, or, just not feeling right, or just something like being off about them, and then finding out they have syphilis then, right? So, and it could be a disease that, again, when I talk about years, I'm talking about sometimes maybe even decades. So it is a disease that will just kind of linger on in your system, causing problems in the background without you even knowing it. And the last stage of syphilis is that tertiary stage, right? And the reason why this is such a bad stage, mind you, we went through the primary, we went through the secondary, we went through this long period where nothing happened. By the time you get to this tertiary stage, you have what we can consider syphilis affecting the brain, syphilis affecting the heart, syphilis affecting the eyes, and other parts of the body as well too. Neurosyphilis is a very common cause for patients to end up in the hospital because they'll actually develop severe headaches, some dementia, again, that's that forgetfulness or just kind of confusion. They'll develop paralysis, almost like a stroke-like symptoms because of the syphilis. And then actually develop vision disturbances as well. So it's extremely important to really try to catch this in that primary stage, because the treatment's all the same. All three of these different stages, all four of these different stages, the treatment's the same. The problem is if you start getting damage to the eyes and from the head and the brain, all this other stuff, a lot of those things become irreversible. And those things we can't do anything about. So it's very important to really, really, be mindful of syphilis, be mindful of symptoms, sores, or anything that may occur. And from the primary care standpoint, or just from the physician standpoint, be mindful of testing for it, right? Especially because, again, your patients can have this latent phase for years and not even know it. But why like syphilis, right? Why was syphilis one of the STDs I wanted to talk about? Because I read this article that talked about the rising tide of syphilis. And according to the CDC, Center of Disease Control, right? Syphilis, in particular at primary and secondary stages, are at its highest rate in about 20 years. From the year 2011, there's been a 67% increase in the rate of syphilis infections here in the United States. And this isn't one population to be infected. This rate increases in affecting every region, every age group, and every race and ethnicity, right? So you really are not you're not going to be able to run away from syphilis, which is pretty much what the numbers are saying. And this is a disease that we kind of had curtailed maybe 10, 15 years ago. And we thought that, one day it would be extinct, right? Because again, when I talk about the treatment, there's one treatment that knocks out syphilis out of here, and it's a penicillin shot, but we can't even get people to do the penicillin shot. One, because they don't come to the doctor to get treated, or they don't even know that they have it. So it's and usually because they have the sore for those 3 to 6 weeks and then it goes away, so they think everything's good to go. And the heavily populated communities who are affected now are gay and bisexual men. They have always had the highest rates of infection in regards to it, but they're also the ones who are most affected by it as well. But what we're starting to see now is that women, that group of women, are becoming an increasing risk of getting syphilis. And because when I talked about how you can actually pass it in the newborns. And I'm not saying when the baby is born. I'm talking about while the baby is still inside. You can have syphilis damage newborns. So we're seeing a lot of transmission to mothers during pregnancy and during birth because of this. So that's why it's become almost a public health issue, right? Because we have a lot of things going right. Like everywhere, every corner you'll see a Walgreens, you see a CVS, right? But most of those pharmacies don't actually carry the penicillin you need to get treated for this syphilis. So, and a lot of times you have to go to the health departments. But what's happening, especially in this day and age, we're having fewer clinics and fewer health departments, just kind of like across the United States, right? Because of funding and everything else. And even when you do have those public health departments in your area, fewer of them are actually even getting the treatment course to need it, right? So again, so you may have a health department in your city, but they may not even have the treatment for syphilis in the city, right? And that's where, again, the public health aspect in medicine is so huge, right? Because we're seeing how much of a public health detriment it's becoming when you don't have the infrastructure and the support system for it, right? They took away money to support these endeavors, to support these clinics, to support these health departments, and now we're starting to see some of the effects from it. So what the CDC wants us to do, right? And again, they want us to do a couple things, right? They want us to, try to figure out some new tools of how to even prevent it or even treat it, right? Because again, we have the same treatment and it works, but we want to have some newer ways to get to that point, right? So you're not having this increased risk. So we're trying to reverse the number of people who are getting it instead of just treat the ones who do have it. We want to focus on specific populations. Again, we're going to focus on our pregnant women. We want to focus on our gay and bisexual men. And in particular, we want to focus on the healthcare providers as well. We want healthcare providers to really get to the point where they're taking extremely accurate histories. And for a lot of people, I know in my case, a lot of my patients in my outpatient practice, I used to always, when I did my STD screening, I would always, check for syphilis, right? So even if you had no symptoms, right, I would check for syphilis. And they would always ask me, well, you check for syphilis, I don't have any sores. Well, I say, well, you don't have any sores now, but maybe you might have had sores, few years ago. You didn't really pay any mind because it went away so quickly. So I'm very diligent on doing my STD screening for pretty much HIV and chlamydia, gonorrhea, and then I'm checking for syphilis as well. So that's definitely something we want to make sure we add on there, kind of moving forward. And I think if we do those things, that's where the benefit will come in terms of treating and trying to reduce this number. Because again, in the past 20 years, right, 67% more are being affected by syphilis, and that's going to be a problem in the long run. So we're going to move right on into our second, and we're going to talk about an article I read that said superbug is now resistant to azithromycin. And for those who may not know what azithromycin is, right, if you have ever had a cold or ever went to a urgent care center, emergency room, or even your doctor's office, and you were given a Z-Pack, that's what azithromycin is. And what that article talked about is how now this sexually transmitted disease, and we're talking about gonorrhea now, how gonorrhea, there are strains that are becoming more and more resistant to azithromycin, right? And why is that important? And we're going to talk about why that's so important, especially in this day and age, right? So I just want to kind of give some numbers on gonorrhea just so you can kind of see what we're dealing with from gonorrhea aspect. 800,000 people will be infected by gonorrhea each year. And this is 800,000 new people. 800,000 new people will be affected by gonorrhea each year. Fewer than half are reported. So think about that, right? So fewer than half are reported, and I've already told you that 800,000 people will be affected by gonorrhea, right? So that's a lot of people who are walking around with gonorrhea, who won't get treated, and who are going to get a lot of side effects that we're going to talk about. There is an increased chance of getting HIV in patients who have gonorrhea. There's an increased chance of becoming infertile in patients who have gonorrhea. There's an increased chance, especially for women, to have ectopic pregnancies because of gonorrhea. So again, gonorrhea is one of those STDs that causes a lot of problems if we're not, taking advantage of it and really putting it at the forefront. Since the 1980s, this gonorrhea, this STD, sexually transmitted disease, has become increasingly resistant to almost everything we throw at it. Since the 1980s, we used to do oral antibiotics, didn't work. We did another oral antibiotic, didn't work. Some of the, in fact, for example, right, the treatment course that we used in the United States for gonorrhea, we can't even use in other parts of the world. So that's kind of showing you how significant gonorrhea has been, especially from an antimicrobial aspect. and how quickly it's becoming resistant to a lot of things that we're trying to throw at it. So what is gonorrhea, right? So gonorrhea is an STD. Again, it affects the genitals, affects the rectum, and as well as affects the throat. And the population that it usually affects are, younger population between the age of 15 to 24. And like syphilis, what we discussed, gonorrhea can also be transferred to the newborn as well. So again, our pregnant women are definitely someone that we're going to want to screen for gonorrhea. And I can tell you right now, if you become pregnant, your OB is pretty much going to screen for every STD under the sun, right? So pregnant women, if they are under the care of someone, an OB-GYN, a midwife, someone who's taking care of them and, doing blood work during their pregnancy, they are not going to be surprised by gonorrhea or syphilis or a lot of these other STDs because they get tested under the sun for it. So the pregnant women I'm talking about is the one who don't know they're pregnant, and two, may know they're pregnant, but they're not going to even seek care, maybe because they think they can't afford it or there's not a health clinic around where they can get that support. So pregnant women are definitely someone we always try to be very mindful of when we're talking about gonorrhea. In men, gonorrhea causes this burning sensation while we're urinating, and it causes a white, yellowish discharge from our penis, right? So those are two symptoms. Those are the two very most common symptoms. Also usually causes some pain and discomfort. But for women, and this is why, we have to be, that's why it's so important, right? Especially like to get tested and, to always kind of know your status, right? Women will usually present with 0 symptoms. So I want y'all to kind of think about that, right? So I've talked about like how terrible this disease is, right? Infertility, pregnancy loss, and all of, increased risk of HIV. And if you're a woman, there's a likely chance that you could have gonorrhea and not even know it. Because for a majority of women, you don't even present with a single symptom. It's not to say that you can't have symptoms, but for a majority of women, you don't present with a single symptom pointing to gonorrhea. A lot of times, your symptoms make it look like it may be just a general urinary infection or a general, yeast infection or what, because those symptoms will kind of mask itself in the setting of gonorrhea. And that's why it's extremely important, again, to get tested and to know your status, because especially for my women, right? And I really, when I talk about STDs, yes, I'm talking to the men. Of course, I'm biased. I got to talk to men. I got to make sure my men are being healthy, but I got to make sure I'm taking care of my women, because the women are the ones who are, being ravaged by these diseases. And a lot of times it's not their fault. A lot of times, someone's giving them the disease and they don't know it. Sometimes the person who's giving the disease doesn't even know they have disease, because there's a lot of diseases that are asymptomatic in men as well. But in particular, gonorrhea sometimes will have no symptoms in women, right? So very important. Again, if they do have symptoms, again, a lot of times it gets mistaken for a urinary tract infection. Sometimes they'll have, painful burning urination. They'll have increased vaginal discharge. Again, does this sound familiar? Again, it doesn't really sound like gonorrhea. It sounds like your normal yeast infection or urinary infection that you may always get. Sometimes they get bleeding during periods. But again, if you're a woman who always gets bleeding during periods, again, that's not something you're going to point to or even know. For both men and women, because we know there is some rectal transmission, you can get some discharge, some itching, some bleeding, some painful bowel movements as well too. So that's another, sign and symptom to kind of think about when we talk about the gonorrhea in that regards. And testing, right? So how do we know if a person has gonorrhea? Urine testing is usually the most common and most quickest way to do it. They are, especially for my women, the OBs can do cervical swabs as well. But I know usually I just order urine cultures, and then I'm able to kind of get my answer right then and there. Because right now we got 2 treatment courses. Right now we got an IV version and a pill. And I say because that means, I'm telling you have to take 2 medications, right? And what the first medication I talked about, the pill form, was the azithromycin, right? That quote unquote that Z-Pack, right? The one that your doctors and your urgent cares and your emergency room physicians are giving out like candy. And I feel strongly, especially from a public health perspective, that I think a lot of the resistance to, especially from azithromycin, is the fact that we keep giving it to people for these common colds that really don't need any medication. We just keep giving. And then if you're going to give a person that, I tell my colleagues all the time, right? If you're going to give a person an antibiotic because you feel they really need an antibiotic, give them a penicillin. Like, stop giving them, these are good antibiotics because we don't really have that much left. And, I can, caveat on why we don't have a lot of antibiotics out there. But that's why it's important for really us to be mindful of, how we're prescribing these medications, because again, now we're running into the superbug, right? And then if the trend holds up, we will start seeing gonorrhea not only resistant to the azithromycin, we'll also see a resistant to rocephin. And then what do you do? And like that, from a public health perspective, scares me, because if my treatment options, again, I went from having in the 1980s 3, 4, 5 different medications I could have gave you, and now I'm down to about 2, and really down to like 1.5. Like that's a problem, right? Because what's going to happen? You're going to get a gonorrhea infection, and I'm going to have to put you inside a hospital, right, to give you antibiotics via an IV, because that's the only way I'm going to be able to treat it, right? And that's a problem that we're running into, and that's something that I foresee will occur if we don't kind of, one, practice safe sex, obviously, and then 2, work on, our prevention, work on diagnosing early, and work on treating when we need to. And, stop, giving our medications, our Z-Packs away for like the common cold, when the common cold caused by a virus. Last but not least, right? And of course, unfortunately, the star of the show is Mr. Usher Raymond, right? And this guy, great singer, right, has been in the news very for I think the past 3 to 4 weeks. I usually be trying to avoid like these celebrity type news, especially in this health related podcasts and videos I do. But when it comes to rise where our celebrity and health kind of like cross paths, I feel like I feel like almost an obligation to kind of like shed some light out there, right? Because unfortunately, I'm starting to see a lot of incorrect information out there. And for those who know, I'm pretty social. Again, I'm on Twitter, I'm on Facebook, I'm on Instagram, I'm on all these like social media outlets, right? And one thing that I notice, I always see a lot of people who I know aren't educated from a medical standpoint saying a lot of like medically related statements as if they're like 100% fact, right? So I want to be able to like kind of put it out there now, put the notion out there now. Let's talk about herpes, and let's talk about all the stuff that's going on, right? So Mr. Usher Raymond, right, he's being sued, right, because he did not disclose that he had herpes, right? And I got some issues with that, right? So I got some issues from a public health perspective, right? And we'll talk about that. And the reason why he got sued is because it was found out in recent court documents that he had to settle with somebody else. I don't know who. Somebody as far as giving that person or exposing that person to herpes. And again, I'm very key on saying exposing and not infecting, right? Because in the general scheme of things, right, especially when we talk about infection, right, like it's very difficult, right, to like say like the herpes that he has is the one that infected her. It's very difficult to say that, right? Why? Because we do not, and I'm not saying that we cannot, we do not do like DNA testing on specific herpes viruses. We just don't. We will do it for like diseases like HIV, because we want to kind of know exactly which specific type we're dealing with, especially when it comes to treatment. But for herpes, we do not. And in this case, I guess he was having sexual relations with this person, and about 2 to 3 weeks later, she started developing these sores. And because she was monogamous, or say she was monogamous, she was able to point back and say, hey, you gave me something. And then at that time, he kind of admitted, hey, yeah, I was diagnosed with herpes. I think it was if I read the court documents, and I definitely encourage all of my people, especially when y'all like are sharing this type of news, like to actually read like the documents that say it, right? Because again, you don't want to like sound crazy when you're online. Read the court documents, and it said that he did confirm that he was diagnosed in like 2009, 2010, and her doctor confirmed that she had never had this disorder before. So I'm assuming for some reason the doctor tested it. And the reason why I say for some reason is because screening for herpes is not recommended by the CDC, right? So I'm not sure why he would have tested her in the past, but maybe she was pregnant or something, and something that would have caused her to be tested. in regards, but she got tested, right? So what's been happening on social media aspect, right, is everyone's saying that Usher has infected this lady with herpes, right? Because I think now there's like 2 or 3 more lawsuits like afterwards, right? So it's getting crazy, right? Which is not surprising, because that's what tends to happen, right? When a shark sees blood in the water, they go. So what's happening is that now they're having multiple lawsuits, and he's under fire, and of course Usher's team isn't really concerned in that regard. Which again, it's very difficult, right? Because from a public health perspective, right, we're going to talk about herpes and some of the numbers with herpes, right, to say what's really kind of going on, right? So I want to just talk about herpes. We're going to talk about in general what herpes is. So let's give some quick facts right after it. Like, herpes obviously is a sexually transmitted disease. There are actually 2 types: type 1, type 2, right? And let's give some numbers out, right? So genital herpes, right, is the most common cause for genital ulcers in the U.S. And a very key factor to kind of differentiate genital herpes sores versus maybe like a syphilis sores is that herpes is extremely painful. So if you hear, and my medical students who are listening or who already know, if you hear painful genital ulcer, you're already thinking herpes. You are not thinking syphilis, right? And that's how us in the medicine world kind of are able to delineate oh, nope, that's syphilis. Oh, no, that's herpes, right? Because the sores will sometimes may look like, they usually don't, but may look alike. Type 1, again, there are 2 types, is usually contacted during childhood. Think about it, right? So type 1 usually contacted during childhood, whereas type 2 is usually contacted during puberty. And the reason why it's during puberty, or usually why it's during those years of puberty, is that's when sexual activity begins to increase, right? And indirectly, for patients who, especially for children, and this is just I don't know how many pediatricians are following the podcast, but you can always drop your comment, let me know. For a type 2 sore, genital sore, if it's found on a child, that's actually a concern for sexual abuse, right? So if we see a type 2 sore on a child, especially a genital sore, and that could be a concern for child abuse, right? So again, just to kind of shoot some numbers and facts out there. So this is what's concerning for me, right? In terms of when we talk about exposure, infection, and everything else, right? By the age of 30, 50% of patients who are what we consider in a high socioeconomic status will be positive for herpes virus, right? 50%. 80% by the age of 30 will, in a lower socioeconomic status, will be positive for the herpes virus as well, right? So think about that, right? By the time you're 30, 50% of the population will have a positive result if I tested them for herpes, which is why the CDC does not recommend us doing it, right? And that's if you're a high socioeconomic status, right? And the reason why they split it up is because people were assuming that herpes was a poor person's disease, right? And we learned very quickly that nope, it is not. And this is even, I think this is even more funny. This should probably turn to feathers, right? By the 5th decade of your life, by the time you're about 50, right, 90% of adults will have antibodies for herpes, right? And again, when I'm testing for herpes, that's what I'm testing for. I'm testing for the actual antibodies for it. So 90% by the time you're 50, right, it's a 90% chance you will be positive for herpes, right? Again, which is the number one reason why CDC does not recommend us just be routinely testing people, because I'll have them go crazy, right? And I can tell you in my office, I discourage my patients from checking if they have herpes all the time, right? Especially if they've never had any outbreak. If you never had an outbreak, I do not want to be testing you. Why? Because the chance is so high that you're going to be positive, and then you're going to be coming back to me with a million other questions. And I try to stop that right in the beginning, right? Worldwide, 23 million new cases of herpes will occur. 23 million worldwide. And from a racial demographic standpoint, 45% of those cases, especially here in the United States, will be for blacks, 22% Hispanics, 17% white will be positive for type 2. Again, type 2 is predominantly becomes affected in puberty and that sexual activity stage of it. So why is that important, right? Especially why are those numbers? Those numbers, shouldn't be well, it's not surprising to most of us in the health field, but I know in the public health, in the public realm, like I know folks are like, what do you mean? Like that's crazy, because they don't even think about it. And genital herpes, that's the one they know about. That's the one they talk about the most, right? Like when we talk about the types, type 1 typically, and I'm going to say typically, causes oral sores, right? Type 1 herpes usually causes oral sores. Well, and predominantly type 2 will cause the genital sores. But in people who are young, or people who are immunocompromised, or gay men or bisexual men, type 1 actually causes more genital outbreaks than anything. So type 1 is responsible for more causes of genital outbreaks of herpes when you're young, when you're gay, when you're bisexual male, or you're at risk compromise. And that's usually my pregnant women. But there are other types too, right? Like I know the fanfare usually is on the genital aspect of it, but of course you can get the oral sores, right? That we call that in medical world herpes labialis. You can get herpetic whitlow, which is actually herpes that occurs on the finger. And people who tend to get affected for that are people who usually don't wear gloves but are working with, like the dentist, right? The dentist, like, again, I don't know a dentist who doesn't wear gloves, but let's say you got a dentist who's some crazy person who doesn't wear gloves, or someone maybe bites you. Let's think about it. That's probably a better example. Let's say someone bites you. Someone bites you, you have a risk of like transferring herpes onto the finger, and it shows up like a skin lesion as well. You can get herpes on the face, arm, neck, or even the trunk of your body. And a lot of times that's just from skin to skin contact. Think about like your wrestlers. Your wrestlers are going to be more likely to be affected by that. And eczema herpeticum, which is pretty much herpes that kind of is superimposed onto patients who deal with chronic eczema, chronic ectopic dermatitis, and everything else kind of under the sun there. So that's why it's important, right? So when we talk about herpes, right, I know genital herpes gets like the fanfare, but we got to remember this can be affected by, this can affect a lot of different organ systems, and a lot of my listeners right now, right, if you're by 30 years old, right, there's at least a 50% chance that you already have the antibodies, even if you've never ever had a cold sore, a genital sore, or anything, right? So I just want y'all to think about that, right? Especially when you talk about being able to sue someone for an exposure aspect of it, right? Because honestly, I can tell you right now, a lot of people could start getting sued for exposure, right? Because a lot of people honestly just don't know they have it, right? Because we don't test them for it, right? So let's do a little quick focus on genital herpes. Let's talk about what happens in women, right? In women, painful, vesicular, and those are like almost like clear fluid-like lesions, affects the external and the internal genitalia, right? Sometimes it affects the internal genitalia where, they just get pain or discomfort while they're urinating, pain while having sex, and, because the herpes definitely likes to affect the mucosal areas. And men get, painful lesions on the penis, scrotum, on the butt, on the thighs, pretty much, wherever in that genital urinary area, men can get lesions on. And when the herpes starts actually tracking back up the urethra, which is, quote unquote, let's consider our pee hole. When the herpes infection actually travels back up the urethra, you can have, severe discharge, severe burning urination, and painful urination. So those are our symptoms, right? And when we move on, right, when all of these things have happened and you finally walked into your doctor's office, right, what can that doctor do for you? Well, for one, just, encourage you and counsel you that there is no cure for herpes, right? Usher was diagnosed in 2009. He was diagnosed in 2009, and he will always have herpes. It's not going away. And it's important to know that, especially when you become infected with herpes from a mental standpoint, right? It's a huge diagnosis, right? It's not like syphilis. It's not like gonorrhea. It's not like chlamydia, right? It's not like I can give you an antibiotic and it goes away and you don't have to worry about it. You do have to worry about it coming back again, especially if you, partake in some of those same activities, but you don't have to worry about that same disease, right, coming back, right? But herpes, HIV, those are like the viral ones. Those are the ones that don't go nowhere. So when we talk about treatment for herpes, we talk about treating the outbreaks of herpes. We talk about treating it with antivirals, including like Valtrex, acyclovir. Those are our two most common ones. There's a couple others, but those are the two most common ones you'll get in an outpatient office. Avoiding sexual contact is big, especially during outbreaks, during treatment. But remember that you do not have to have Remember, you do not have to have a genital outbreak, right, to be still passing on the virus, right? And I think that's where Usher's problem really comes into play, right? Is that he may not have had any outbreak during the time he was having sexual relations with that lady. But the problem is, because you got that virus, because that virus never goes anywhere, you always have that risk of passing it on, right? So I think that's where, his problem lies, right? His problem lies is, one, he knew that he had the disorder and he didn't disclose that he had the disorder. And, from a time standpoint, there was enough evidence to say that, he was the likely one to expose the girl in that regards, right? So those three things, right? Herpes, syphilis, gonorrhea, those 3 STDs were something that, been in the news a lot in this past, 6 months. And it's something that, from a public, the physician, becomes very concerned. Because again, STDs is a very issue that I used to see a lot in my outpatient practice, but also from a public health perspective, like I think being knowledgeable of what the risk factors are, how can you get it, how can you prevent it, how you can treat it, will go a long way for you guys. Okay, again, this is a special edition of the Lunch and Learn. Hope you enjoyed it, and I'm gonna see you guys on Thursday.
Thank you for listening to the Lunch and Learn with Dr. Barry. I hope you enjoyed that episode like I enjoyed giving you that episode for your listening pleasure. If you want, please join the community. Please tell a friend to join the community. I'm over at Twitter. I'm over at Facebook. I'm even over at Pinterest. Like, I'm everywhere where you want to be. I'm probably there. My username is pretty much the same everywhere you go. lunchlearnpod.com. Lunch Learn Pod at Facebook, Lunch Learn Pod at Twitter, and the hashtag that we're using, especially when you're listening to the episode and you want to share it and you want to tell all your friends, is Lunch Learn Pod as well, all one word. And before I let you go, please do me a favor. Head over to Apple Podcasts, Google Play, SoundCloud, Stitcher Radio, TuneIn Radio, wherever you like to listen to your podcast. And even if you like listening on my website, leave me a comment, leave me a review, let me know how I'm doing. Leave me even a comment to say, hey, I'd like to hear about this topic versus that topic, and I'll be gladly able to kind of squeeze that in on this schedule. And you guys continue to have a great and blessed day, and I'm going to see you guys next week.